Nothing is more important than our health. And what's true of individuals is also
it's a major development that could affect the health of hundreds of thousands of Hoosiers.
The federal government is clearing the way for an expansion of the state's alternative to Medicaid. Governor Pence announced approval of the updated Healthy Indiana Plan, HIP 2.0. RTV 6 State House reporter Katie Hines is live to explain for us. Katie?
Todd and Erica, it's the news. Governor Mike Pence has been hoping to hear now for 7 months. He says HIP 2.0 is a first of its kind program, closing the gap for 350,000 Hoosiers who aren't covered.
our state can begin covering our uninsured working poor the Indiana way, based on personal responsibility and consumer-driven health care.
Governor Mike Pence says HIP 2.0 will make health care affordable for hundreds of thousands of Hoosiers. Shirley Hale is one. She lost her job.
Yes, I've been without insurance for approximately 10 months, and I just know that at my age, 57, that I might need it.
People ages 19 to 64 who make less than $16,105 annually will be eligible to enroll. So will families of 4 with an income of $32,913 or less. The two-tiered system offers incentives to make monthly payments to a health savings account. People who contribute at least $1 per month will have access to the HIP Plus plan. That includes dental and vision care. People who don't will be placed in the default HIP Basic plan. They'll face reduced benefits and co-payments, and they could face loss of coverage if they're above the poverty line.
The amount the hospitals put up to help fund this will be paid back by the coverage that's provided to the patients. So as the patients come in for the care, that's really the return that comes from it.
Hospital assessment fees and cigarette tax revenue will cover the state's share of the cost, estimated at $1.5 billion over the next 5 years. The federal government will pay for the costs associated with new enrollees through next year. Then the federal share will gradually decline.
We could literally point to specific results from current enrollees in the Healthy Indiana Plan, and that greatly bolstered our case.
The state plans to transition all able-bodied adults who are currently enrolled in Medicaid into HIP 2.0, and coverage starts Sunday. To sign up, head to theindychannel.com. Reporting in the newsroom, Katie Hines, RTV 6.
All right, big news for Governor Pence. Thank you, Katie.